Developing tonight, we are learning of a measles case that quietly slipped in and out of Utah last month.
Yeah, so News Special Shara Park joins us live right now from the Utah Department of Health. That's where officials decided not to inform the public. All right, Shara, explain why.
Yeah, Mike and Debbie, we're getting some new information on this case this afternoon. The Utah Department of Health and Human Services said this individual with measles, this person had been vaccinated and posed a low risk of infection to others. Now, we learned about this measles case because it was brought up in the Summit County Board of Health meeting yesterday afternoon. In that meeting, Nursing Director Derek Moss said that on May 19th, a person with measles flew from Canada to Salt Lake International and drove to southern Idaho to visit family, not making any stops along the way. Then a few days later, came back to Utah.
May 23rd, that same individual came back to Salt Lake. Again, didn't make any stops, but did get on board an airplane while symptomatic.
Well, the Utah Department of Health and Human Services did clarify a few details this afternoon, saying the person became symptomatic while in Idaho, and all exposure concerns were in that state only. They say the person was cleared by health officials there to fly home because they were past their infection period. Now, as a precaution, passengers on the flight were contacted by Salt Lake health officials and connected to services to prevent infection, and at this point, no one has developed an infection. Now, in a statement, the Utah Department of Health and Human Services addressed not informing the public of this measles scare last month, saying public health officials weigh many factors when we decide whether to notify the public about a situation. In low-risk situations, when we are able to address the issue in a more focused and isolated manner, broad public messaging is not always warranted. Additional information would be released if the situation changes or more data suggests an increased risk. Now, measles, as we know, is highly contagious, which is why most medical providers recommend the MMR vaccine. The Utah Department of Health is encouraging Utahns to talk to their doctors about getting that MMR vaccine if they have any summer travel plans. For Live at 5 here in Salt Lake City, I'm Shara Park.